What makes mediastinoscopy an invasive lung cancer biopsy? Imagine needing to look inside your chest to find out if lung cancer has spread to the lymph nodes in the middle of your chest. That's where mediastinoscopy comes in. It's called an invasive procedure because it involves more than just a simple needle or scope. It requires making a small cut through the skin, usually just above the breastbone or at the base of the neck. This incision is typically about 1.5 inches long. Once the cut is made, a special instrument called a mediastinoscope is inserted into the chest. This device is a thin tube with a light and camera attached, allowing doctors to see inside the mediastinum, which is the central part of the chest between the lungs. Because the mediastinum contains vital structures like the heart, major blood vessels, the windpipe, and the esophagus, navigating this area is delicate work. The patient is placed under general anesthesia, meaning they are completely asleep and unaware during the procedure. This ensures they do not feel pain and remains still, which is crucial when working near such important organs. The doctor carefully advances the mediastinoscope through the incision, visualizing and reaching the lymph nodes or tissues that may harbor cancer cells. If cancer is suspected or confirmed, tissue samples are physically removed for microscopic examination. This process is considered invasive because it involves cutting through skin and tissues, entering a space filled with critical structures, and manipulating these parts directly. It's more involved than less invasive options like needle biopsies, which use a thin needle to collect tissue through the skin, or bronchoscopic biopsies, which use a flexible tube inserted into the airways. While those methods are safer and quicker, they sometimes don't provide enough tissue for a definitive diagnosis. Mediastinoscopy allows doctors to obtain larger tissue samples and see the area directly, which can be essential for accurate staging of lung cancer. However, because it is a surgical procedure, mediastinoscopy carries certain risks. These include bleeding, infection, or accidental injury to nearby structures like blood vessels or nerves. Recovery time is also needed, usually involving a short hospital stay and some discomfort. The decision to perform a mediastinoscopy depends on the individual's situation, including the location of the tumor and the likelihood of lymph node involvement. In summary, mediastinoscopy is considered an invasive lung cancer biopsy because it involves making an incision, inserting a specialized instrument into the chest, and directly visualizing and sampling tissues in an area packed with vital organs. Its invasiveness is justified by its ability to provide detailed information about cancer spread, which is crucial for planning effective treatment. Always remember, if you or someone you know is facing this procedure, consulting with a healthcare professional is essential to understand the risks and benefits based on personal health circumstances.